What is happy tail syndrome in dogs and how can it be treated? Most dogs have 20 vertebrae in their tail. Some breeds with shorter tails don't have quite as many. Happy tail syndrome in dogs occurs when they repeatedly hit their tail on solid objects with force. So that's where the name comes from, right? Happy dogs wag their tails, and this incessant wagging can sometimes lead to injury. If your dog's, really exuberantly wagging his tail and hits it off of a table leg or a chair, or hits it on a wall. I know our chocolate lab has done it before. She's laying on the ground, and if she's laying on, like in the garage on a cement floor, and she's wagging her tail, that kind of force on the tail will injure it sometimes. So if your dog's an aggressive wagger, he may forcefully whack his tail into walls, furniture, table legs, like I said, and cause this problem. Happy tail is when the thin skin on the dog's tail will split. And so the first sign is to notice blood splatters around the area. Maybe they're on the floor or on the wall where he hit his tail. So you'll notice those little blood splatters. You would think that an injury like this would stop your dog from wagging, but it won't. He's gonna keep wagging his tail, which is what makes happy tail so difficult to treat. It also makes the condition especially painful for your dog because he'll continue hitting his tail off of objects when it's already injured. If left untreated, the tail could become infected. That would lead to nerve damage, and in extreme cases, the tail could need to be amputated. Sometimes if a dog repeatedly has the same injury, the vet will recommend amputation because the injury continues to happen. And obviously, this is going to be a problem with this particular dog. So that's something that, like I said, your vet may recommend, but that's, a worst case scenario type thing. Large breeds with skinny, powerful tails are the most susceptible to this condition. So breeds like Great Danes, Pit Bulls, Greyhounds may be more prone to developing happy tail syndrome, but any breed can have this problem. Obviously, breeds with shorter tails or curly tails, like you think of like a chow, they're not going to be having this issue as often because even when their tail wags, it's kind of up and tucked and it's not slapping against things. Think of those breeds like the Pit Bull, like the Greyhound. They have those long whip-like tails that, they don't have a lot of hair padding them when they're wagging it and hitting it off things. That's when the injury occurs most often. So as I mentioned, you may notice blood splatters around your home or on your pet's bedding. You may also see that the tail's losing hair in the area where it's been injured, that the skin is dry, cracked, but maybe hasn't started bleeding yet. In the beginning, happy tail won't have any other symptoms other than the visible signs of the condition on the tail, which is why it's so important for you to be observant of your pet. If it's not treated promptly, like I said, you're going to notice signs of infection like lethargy, eating less or not eating at all, refusing to drink water, fever, diarrhea. If you notice any signs of infection, whether you think your dog has happy tail or not, any signs of infection, you should not try to treat the condition at home. It's important to consult your veterinarian right away because your dog might need antibiotics or other medical care. Treatment usually can be done at home if you catch it early. But as I said, there's not a lot of symptoms other than the visible signs on the tail. So if you happen to miss that, it could become infected and you're going to have to seek veterinary care. You can, if you feel like this injury just happened, maybe you watched it happen and noticed the blood splatters immediately, you can try to treat the injury by cleaning the wound and wrapping it. It's important to keep your dog as quiet as possible so that he doesn't risk hitting his tail again. As I said, you would think that after an injury to the tail, the dog would not wag anymore, but they will still wag their tail, which could really easily cause re-injury. If you're not able to treat the injury quickly, there's a good chance that it will become infected, as I said. So your dog's tail, obviously it's close to his rear end, it's in that area. This means it may touch the ground often. It could touch his feces or his urine when he's going to the bathroom. This is an area that becomes infected very quickly if not cared for properly. So if you're unsure of how to treat it, if you're not very confident in your abilities, if you don't have a lot of experience with dogs and you would feel better taking your dog to the veterinarian, absolutely. This is not something that should wait. It's not something that your veterinarian is going to think, oh, it's kind of silly that you brought your dog in for this. This is something that definitely should be seen by a medical professional. An open wound in that tail area is just asking for trouble. So the quicker you can treat it, the better. If infection has already set in, like I mentioned, those symptoms, if you're noticing that, if your dog suffers from happy tail on a regular basis, your vet, like I said, could recommend amputation. This is something that's between you and your veterinarian. They will give you that option and talk to you about the process, how much it costs, the risks to your dog. If they do decide to treat the condition, it's probably going to be with a few different medications. And anti-inflammatory, antibiotics, and pain medications may all be part of your pet's treatment regimen. He may also need to take a sedative for a few days just to ensure that he stays quiet and he's not wagging his tail and re-injuring it. Tail slings, which if you click the link below this video, you can see some photos of those, what they look like, and some options if you would like to invest in one. Tail slings are helpful when your pet is diagnosed with happy tail. They basically brace the tail. They hook onto the back end, they brace the tail and hold it still, while also there's like a sleeve that goes down over the tail to help protect it from further injury. If the injury is in a place that can be treated and covered, you should also fit your dog with an e-collar to prevent him from, licking any ointment off, chewing the area. Obviously, there's going to be some pain associated with it. So if he's trying to lick it, or if it gets itchy as it's healing and he's trying to chew it, that could re-injure the area as well. So you want to make sure, an e-collar, they're cheap. I actually have a video on how to make your own e-collar, and it's a better safe than sorry kind of thing. Equip him with an e-collar for a couple of days. He's not going to be very happy about it, but it's going to save you from dealing with infection down the road. If you do decide to treat the injury at home, like I said, keep a really close eye on it, look for those signs of infection, and call your vet if you have any cause for concern.